Here to discuss what caregivers need to know if someone they love is having auditory or speech language issues and how they can break down those communication barriers. I have Dr. Bernadette Mayfield-Clark, PhD, and Tena McNamara of the American Speech Language Hearing Association. Good morning, ladies. How are you?
We're good. Good morning to you.
Doing wonderful. Thank you.
Thank you. Great. Dr. Clark, when it comes to the caregiver experience, how important is effective communication?
Effective communication is a human right when it goes well. When it doesn't, you find that the caregiver becomes quite challenged because the care recipient feels like her message or his message has not been received appropriately. It frustrates the caregiver, but it causes emotional outbursts and anger in the care recipient. What tends to happen is the caregiver is not really sure if the care recipient received the information or understood the information. In other words, did they hear the information or did they not understand what was being asked of them? And as a result, the caregiver should seek professional services from an audiologist and a speech language pathologist. We received very high ratings from the caregivers poll, indicating that once they did, their daily lives became a lot more livable and functional. And the ability to be able to communicate a lot more effectively became a wonderful issue for both of them.
Now, Dr. McNamara, what should we do if someone we love is having issues with their hearing?
If they're having issues with their hearing, see a professional. Hearing loss plays a significant factor in your overall health. It affects your social emotional well-being. They've even related hearing loss to physical types of symptoms. And there's some initial studies out there that suggest that there may be a relationship between hearing loss and cognition. So if you suspect that someone has a hearing loss or you're even unsure, take them to a professional, take them to an audiologist to get tested. As Dr. Clark mentioned, ASHA.org has a list of audiologists that you can find in your area, or also ask around. Ask individuals who have received treatment for hearing loss. And, usually you can find a pretty good recommendation in that area.
Now, Dr. Clark, a recent poll has been done. Can you tell us about the poll and some of the key findings?
Yes, the poll was conducted by YouGov in March, commissioned by ASHA. And what it found was that the caregivers who provide the services for the individuals found communication difficulties and other disorders. As a result, the polls will be released today. So you'll be able to find it at ASHA.org and all of the results. But overall, once they identified that there was difficulty with the hearing or with cognition, they were able to receive the services and support from audiologist and or speech language pathologist. Again, ASHA.org or 211, which is the Caregivers National Hotline.
And I think to add to Dr. Clark's comments, one of the things that was also found that there were, a lot of the caregivers reported strain on their mental health. They need support. A lot of this support comes from professionals. So if, we need to make sure they get connected with these professionals, maybe through their local Department of Aging, health, or education, but also as just a neighbor and a friend, be there to listen without judgment, to encourage self-care, to help them connect with professionals. Is extremely important. And this is one thing that we found from the studies. They need that support.
Doctors, let me ask a particular question. Now, you're talking about hearing and communication. What if you ask somebody a question and they just kind of had that deer in headlights look? Could it be possibly a mental situation or a hearing situation?
It could be a combination of both. And that's where we come in to be able to discern whether or not it is a cognitive issue or is it a hearing issue. And the only way you can be certain of, as Dr. McNamara said, is to seek the services of an audiologist and a speech language pathologist. And once you do that, it will make a difference in terms of effective communication and making it available to the caregiver and the care recipient so that their daily lives become a lot more durable and caregiving becomes a lot more functional as opposed to a strain on the actual individual.
And if there's ever any question about hearing, get it tested. Even if your hearing comes back okay, what's beneficial about that is you have a baseline for the rest of your life because your hearing will decrease with age, and it'll be you'll be able to see where your hearing was and if there were any changes with it. So whenever in doubt, get tested. And that also goes for if you have any types of communication concerns, get tested by an SLP.
One more time, Dr. McNamara, give us that. Where can we go for more information?
At ASHA.org. And as Dr. Clark mentioned, for caregivers, there is a hotline, 211, that offers some references of services.
Dr. McNamara, Dr. Clark, thank you so much for joining us on Morning Blend. I really appreciate it. Thank you.
Well,
Thank
thank you
you
for having us.
It was a pleasure.